much for joining us on the program Healthy Living. I am Adesuwa Osawage. Last week we started infertility, treatment and management on the program. And we did say that when we come back today, we will answer all the questions that you sent to us that weren't answered. And I still have with me Dr. Stephen Ogboma, is the CMD of Gable End Hospital. He's here with us, and he is going to answer all of your questions. And of course, he is a gynecologist and a gentleman. It's nice to have you join us today.
Thank you very much.
I know that was going to make you laugh. Yeah. All right, last week we started infertility, and I would like you to talk about it a little bit before we go straight into the questions that were asked. And of course, you have a chance to ask questions. If only you will call our number, which is 052-290-573. And of course, the WhatsApp number is going to be on your screen in a moment. Use it, ask your questions. There is no point in trying to ask somebody who is not an expert on the field. That it worked for one person does not mean it won't work for you, or that it will work for you. All you have to do is ask a doctor, a professional at that, who is going to allay your fears. All right? He also told us that fertility can be treated. It depends on you. So, doctor, can we quickly go over what infertility is again in both men and women?
Yeah, fertility is very important in this part of Africa, because as Africans, Nigerians, and Edo people, we place a lot of premium on children. So when a woman lacks the ability to produce a child within an appropriate time, neighbors, friends, in-laws, you know, they raise their eyebrow. So the WHO definition is that in 12 calendar months, in the absence of any other problems, a woman, a couple having regular sexual relationship, they are unable to produce a child, we can refer to them as being subfertile. Really speaking, you can't say a woman is infertile because you have not looked at her critically. And even as we speak, in the best clinics in the world, we're still discovering things that causes subfertility. So you cannot refer to a woman as being infertile. So infertility per se, when a woman lacks or is unable to produce a child after 12 calendar months of regular sexual relationship. But for an older woman, a 35-year-old woman per se, or a man known to have inadequate sperm count, then you say 6 months. In that case, 12 calendar months will be too long. So that's WHO definition, fertility.
All right, thank you very much, Dr. Obama. Now, let's go to some of the questions that were asked that we didn't have time to answer the other time. Now, a couple of persons did send a message to ask what ovulation induction means. How do you treat fertility using ovulation induction?
Okay, ovulation induction is treating a specific aspect of subfertility. As you are aware, there are so many causes of subfertility. When an individual is unable to ovulate during the menstrual cycle, you can say, or induce it with drugs. The use of drugs to enable a woman to produce a fertilizable egg in the menstrual cycle is regarded as ovulation induction.
Okay. All right. Another person said that we don't want to mention it now because the woman said she does not want her name to be mentioned, that egg donation, that she once went abroad and something like that happened, but it didn't work. So she's now asking, how do egg donation help? Yeah. Especially in a country like Nigeria.
We do egg donation. Egg donation can be done in Benin City. There is no big deal about it. What it means is that when you get older, beyond the age of 35, the strength of the egg decreases. You know, the ability of that egg to be fertilized reduces. And the number of eggs that are recruited for fertilization in a particular menstrual cycle reduces. And finally, the ovarian capital, that the number of eggs the woman was endowed with at birth, is significantly also reduced. So for that 45 or 40-year-old woman who unfortunately is unable to produce these eggs, will benefit from a donation from a younger woman, say an 18, 20, 25, 28-year-old woman. You stimulate that woman to produce more than one egg. Generally, women produce just one single egg, and in certain situations, 2 or 3, but never more. But in an IVF cycle or in an egg donation cycle, we give such women more treatment, some specific hormone treatment to enable them to produce more eggs, so that these eggs are obtained and used to fertilize the spermatozoa from the recipient husband. And subsequently, when we look at the embryo, we grade the embryo, and the embryos are viable, then such embryos are transferred, into the recipient. So the woman, yes, it can be done in Benin City if people have the resources to pay for it. Okay. Yeah.
All right, Anne Ogun, she said, Anne Ogun from Ondo State says she's 55 and she had done IVF like 3 times without success. The very last one, the third one she did, I think she was pregnant for about 4 months before everything came down again. And she said, what's the best fertility program for her at 55?
Yeah, at 55, unfortunately, like I've just mentioned, is that those eggs are fertilizable. She lacks the ability to carry the pregnancy to term. The likelihood of miscarriage in a 55-year-old woman is higher. Her chromosomes may be abnormal. So such women will benefit from a donor program, where a younger girl donates her egg and is fertilized by the spouse's spermatozoa and transferred into the recipient, who in this case is the 55-year-old lady. So there can still be problems like miscarriages, or early miscarriages, or late miscarriages, or preterm labor, as the case may be. So in such situation, you just go to the best clinic that is available, and you'll be treated with the most recent modern technology. And there's always a part of it that is down to luck, because if you were to treat 10 people, 2 of them will carry pregnancy to term. So the take-home baby rate is 1 in 5 in most centers. In the best centers in Europe is, you say 2 in 5, which is very good. And now, when we allow the egg and this fertilized embryo to grow beyond the modular stage up to 16-cell stage or even more, then there's an enhanced chances of being able to carry a baby home. But that does not remove the problem of having a miscarriage, early miscarriage, late miscarriage, or a preterm delivery.
So how can that be avoided?
Well, avoiding them, you can support the pregnancy with some medication. These are hormones which the woman may lack as a 55-year-old woman, and this is given from outside to support that pregnancy throughout. So she can benefit from some drugs, to dilate the blood vessels and ensure adequate blood supply to the placenta to enable the fertilized egg to grow. Because after implantation, and there's good blood supply, because the placenta is the source of oxygen, nutrition and excretion for the growing fetus. If it is inadequate as a result of abnormal changes at the level of the villus supplying the placenta, then the baby will not thrive, the baby will be miscarried at a point. So if all these drugs are used to support, then there is the likelihood of success. But if she says she's been to the best centers in Europe, then I would say she should pray, and God may help her. because it's not all the time. I know a woman in Nottingham, in England, who did it for 17 times, and at the 17th time, she got 2 babies home.
How old was the woman?
This woman, she was just 37 years old. Okay. She was not too, well, by IVF standard, the government allowed us to treat 37-year-old quite readily. So she does not fall into the class that is unacceptable in terms of IVF treatment. When you are 45 and above, nobody's going to touch you. Because because the chances of success is very, very low. You're looking at about 5, in 100. That's 1 in 20 compared to 1 in 5, which is quite
some
high.
bad news for women who are 45 and above, who are looking forward to having an IVF.
All the time I come to this program, I always say, don't defer making babies. Make your babies when you are young, so that you all grow together.
These men don't want to marry on time. So what do you want the women to do?
When women get pregnant, they go to quacks to terminate such pregnancy that predisposes them to problems. Because of our belief, you should not terminate any pregnancy. When you're pregnant, have the baby. There are so many women out there who want babies. Churches, they want babies. There are all various, charity groups. They want babies. They can take the baby and support the baby. You don't need to terminate the pregnancy. You don't need to, because when you are seeking one, you may never get it. So when you are young, your body is ready for a pregnancy, and you unfortunately become pregnant, have a baby. But the best thing as an educated mind is to use methods of contraception. There are quite many available, viable, methods of contraception that are reversible, that women can use and protect themselves from getting pregnant. So, but if unfortunately you do not use a method of contraception and you do not remember to use, after pills, then leave the pregnancy and carry pregnancy to term, because there are so many people looking for a baby.
Okay. Yeah. All right, Doctor, you're watching us on ITV, Benin City, Edo State, Nigeria, and we're looking at infertility and then possible ways of fertility program. Now, Doctor, I got this one, but before then, let's quickly roll out our numbers again. You want to call us, please do that on 052-290-573. It's very important that you call in, talk to the doctor, or you call us on 052-290-572. Call the doctor, ask him every question you need to ask him. Okay, a question came in from Ehikioya A. She says she's a 40-year-old woman, and then she hear people say that they have their periods between 3 to 5 days. But unfortunately, she has never had a period more than once, at most 2 times in a row, maybe 2 days. The first day will come out, very much, while on the second day to just be spots.
Yeah, menstruation can last from 2 days, to 7 days.
Yes, and she says that it is even irregular. It has never ever been regular. And she asked the question, what's the chances of getting pregnant?
If she's having periods, she has a good chance of achieving a pregnancy. But if she's not having a period at all, or she does not have a period for 3 months or 4 months, then there is a problem. Then she should seek help from a gynecologist. But if every month she bleeds, it means that she's cycling.
Even if it's a day?
A day or 2, that's okay. It means she's cycling and she's releasing egg. All she needs to do is she can check her blood, after 21 days, or what we call the luteal phase, the progesterone check, or she can go to a gynecologist who will scan her at the beginning of the cycle. At mid-cycle, they repeat the ultrasound scan, and they repeat the ultrasound scan, at the mid-cycle, and see if she's producing an egg. Okay. Yes, and you will see the egg, the ovary will change inside, the morphology of the ovary will change, and you will see an oocyte, a human oocyte, the egg there, and you can measure the size. It can range from 5 mm to up to 20 mm, and when the egg is ready to be released. So she doesn't have a problem. Okay. So long she's cycling. And what she said, she's cycling, but she's not bleeding. We are all different. So please know that we are all different. We cannot all produce, bleeding for 5 days or 7 days. So if your friend is having a period for 5 days and you are having a period for 2 days, it does not mean you are abnormal. You are normal. You are a variant of a normal, because it is a range. We talk about a range from 2, a range of 2 to a range of 5, a range of 7.
Okay. So what's the possible fertility program available for somebody who is almost an hermaphrodite? That is the question. She's more male than she's female.
Yeah, well.
But she wants to be a female.
Yeah, what's important in a hermaphrodite is the sex of hearing. Genetically, the individual may show features of both, male and female. But what is the sex of hearing? If the mother brought the child up as a female, then we should manage her as a female. If the child is brought up as a male, then the child will be managed as a male. So the main factor, the main overriding factor is the sex of rearing. How was the child reared? How is the child recognized in the family? How is the child recognized in the school? What's the name of the child? Is he, Stephanie or Stephen, as the case may be? So all these matters. So that would determine the kind of fertility treatment the child will have. The child may be treated as a female who is unable to produce an egg, in which case they will, create, what we call a new vagina for her, so that she can have a relationship, or she's regarded as a male, in which case they can create a phallus for her.
Okay, I'll ask you another follow-up question on that. Hello, we have a call. Hello, caller, what's your name?
Hello, good afternoon.
Good afternoon, caller. What is your name?
My name is Doris. I'm calling from.
Okay, please ask your question.
It's a 4 weeks pregnant, and I have cyst on my urine.
There's what?
Something on my urine.
Okay, there's something on your urine.
Protein.
Okay.
On my urine, and I'm 4 weeks pregnant.
Okay.
So I don't know if there's any solution to it.
Hold on, dear. Hold on. Can you just ask the question again, because we can hardly hear you?
Okay. I said I'm 24 weeks pregnant.
Okay.
Yep. Okay.
And there's protein on my
urine. Your urine?
Yes, protein.
Protein. She's got protein in her urine.
Okay. Yes.
Okay.
This is your first baby, am I right?
No, third.
Third baby. Okay.
Yes, sir.
If you have protein in your urine, it might be a sign of infection, urinary tract infection. If it was your first baby, I'll be thinking of many other diseases. Because like preeclampsia can occur very quite early in women who are having their first baby. But you are having your third baby, it's most likely to be urinary tract infection. When you go to pass urine, is it sore? Is it painful?
No.
It's not painful, it comes out. Do you pass urine much more than you normally pass? Do you go like 10 times instead of going 6 times a day or 4 or 5 times a day?
Normal.
Everything is normal. You always saw protein in your urine.
Yes.
Okay. What you need to do is that we need to see you and do more tests and make a confirmation of what the likely pathology is. But if you don't have infection, you don't have preeclampsia, those are the big ones, then it's likely that you may have other kidney problems. Are you aware you are nephrotic? Do you have swollen faces, swollen lower limbs and upper limbs? Swollen faces. Okay, we are getting there. So we know you're more likely to be nephrotic. If you are nephrotic, you need to see, a physician who is a specialist, in kidney management. What it means is that you are eating, you are metabolizing your protein, and they are just going through, your body lacks the ability to retrieve the protein back into the system, so you're losing it. So they are measuring it in your urine. Because you now lack the oncotic pressure, the power that keeps the protein within the intravascular system, then you find that water is seeping through your blood vessels into your cellular space, and you are getting puffy. When they press on your skin, it will just go like bread. Am I right?
Yes.
That's it. So you need to see somebody who will direct you to the best doctor who will look after you. The case is manageable, but it can be dangerous if you leave it to chance, especially now you are pregnant. You are, you are creating more problems for that kidney. You are giving that kidney increased workload. You see, when you overwork people, when you overwork a slave, the slave dies. So go and see somebody who will look after you. They should not allow your pregnancy to get to 10. If by the time you are 34 to 36 weeks, they should get the baby out. Because the longer the baby stays there, the longer your body will suffer, the longer your kidney in particular will suffer. Is that okay?
Yes, sir. But what they are telling me now is that they say they should evacuate they should terminate the pregnancy.
Yeah, well, you see, for the same reason, if you are 34 weeks, I think we can manage you aggressively and keep the baby there for just a few days so that our neonatal colleagues can take the baby from 28, 30 weeks and they will look after the baby. Then the effect on your kidney can be reduced. Okay? Yes. But all this I'm saying from my head. It's always best to have a look at you, to assess you, check how things are, and make the decision. So the doctors who see you, who are doing all the tests, they are more likely to make a better decision than I'm going to make over the television. Is that okay?
Yes, sir.
Okay, thank you.
Sir.
All right.
All right, the number again is 052290573. We are looking at the possible ways, possible program of managing infertility. All right, doctor, we're talking about somebody who is hermaphrodite, and the thing is, what is responsible? Okay, we have another call. Hello? 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 Okay, I'm sure we lost that call. Hello? 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 Yeah, can you just reduce the audio level on your television set so that we can talk? Hello? All right, we lost that call. Please, when you're calling into the program, kindly reduce the audio level on your television set so that we can hear you properly. Hello, caller.
Hello.
Hello, good afternoon. Good afternoon, we can hear you. Okay, we lost that call. Hello, good afternoon. Please reduce the audio level on your television set so that we can talk.
Please, I want to ask...
What's your name, caller, and where are you calling from?
I'm calling from Airport Road.
Okay, and what's your name?
Yeah. Please, I want to ask Dr. a question, please.
Go ahead.
I always have back pain and the waist pain.
Can you come again with your question?
Yeah?
Come again with your question, please.
I said I always have waist pain and back pain.
You always have waist pain and back pain.
Yes, and my urine is always yellow as the other.
Your urine is always yellow in color.
Yes.
Does that have to do with infertility?
No, that's not an infertility question.
Okay.
If you have waist pain, just see that's a musculoskeletal problem. And you see our orthopedic colleagues, they will look after you. But generally, what I've found out is that people do not sit the appropriate way. They do not walk well. When they are working on their computer, they do not sit appropriately. Because of that, they put a lot of strain on their, the muscles that keep us erect. So that produces back pain and waist pain. And all you need to do is to change your posture of walking, of sitting, and you'll feel better.
Okay, let's look at this hermaphrodite as a problem. What is the cause of this? Why do people come out that way?
The percentage of hermaphrodite
yes.
in
the
population is very, very low. It's a genetic aberration where the baby shows signs of both male and female. But sometimes they show it's a female who has a clitoris that looks like a phallus. That's a clitoris that looks like a penis. And when you try to check the vagina, you might just see that it's a dimple. They show features of both male and female. And because of that, it may be as a result of the abnormal hormones, of the abnormal genetic features that they are endowed with. So going into that, we start it's just like what we refer to like in Downs. Instead of having two S chromosomes, they have one. Some of these abnormal babies showing hemorrhagic symptoms, they may have SSSY or SSSY or SYY, and it's abnormal, unfortunately, so they show different features. It just changes as a result of abnormal chromosomes. See, the last time we talked about chromosomes, somewhere else, where I talked about you can have a deletion where part of the chromosome is removed. You can have an addition. Sometimes chromosomes are supposed to divide and separate. They do not separate, we call non-disjunction. When all these abnormal chromosomes, instead of one having a part from the father and a part from the mother to form a whole of 46 chromosomes, they have more than enough. Hence you have those who are deleted might have SO deletion. Those who are non-disjointed chromosomes, they have SSS, can have 3 S's and a Y, and it becomes abnormal. So the population, the percentage of this abnormality in the population is quite small. So it's very rare, and you might find in the whole of Benin City with a population of about 1.2 million, that the hermaphrodite might just be about 2 or 3. So it's very small. So it's not what you come across on a regular basis. Okay, doctor, let us look at fertility programs that one may, adopt or use to have kids. Well, okay, before that, let's take this call. Hello?
Hello?
Yeah, good afternoon. What's your name, caller?
Afternoon. This is calling from a
Can you speak up a bit?
I'm calling from a road.
Okay, how are you doing?
Fine.
All right, ask the doctor your question.
I wanted to ask the doctor. I always have inside my room.
We can barely hear you. We're straining our ears to hear you.
I always have a pain inside my room, my left hand side.
You always have what?
Pain inside my wrist, at the side of my wrist, under my wrist. So
okay.
I went for a scan. He said it's something like that or something. I don't really understand. Which I took to my doctor. He only prescribed some drugs for me, which I took. After a while, the thing started again.
Okay, doctor, did you hear that?
I didn't hear that.
Okay, please, I think you have to call us back. We only had pain. Pain on the left side of your ribs. It can be as a result of a lot of problems based on the organs that are in that area. On the left-hand side, you have the spleen there. You have the muscle, you're starting from the skin. You have the ribs, the costochondral junction. Quite a lot of things can predispose to pain in that area. So unless you are examined in a clinic, nobody will be able to tell you what the cause of the pain is. It might just be from the kidney. The kidney might be enlarging, or it might have a kidney stone, or it can be anything. All right, thank you, doctor. Now let's look at fertility programs that one can go into. Okay. Like how many do we have? Well, there are a few programs an infertile couple can get into, depending the kind of program that people will initiate you into is determined by the nature of your subfertility, the cause of the subfertility, the age of the couple, for how long have they been striving to achieve a pregnancy. So the easiest and cheapest and most available
is intrauterine insemination. But even before we get to that, there are those we just do ovulation induction. We mentioned ovulation induction earlier on in the program. It's just to, after checking you, everything is fine, they just give you a little bit of hand with the use of some tablets and monitor you with ultrasound scan throughout the cycle to see if you are going to release an egg. On ultrasound scan, they will be able to see if you are actually releasing egg. With this ovulation induction, depending on the tablets or injections that were used, you will be able to produce more eggs than you would normally produce. And at the end, it will tell you this is time to have a relationship with your partner. So that is one method. That we call it follicle tracking. We will track the follicle and tell you when the egg is going to be released and when you should meet with your partner so that you achieve the pregnancy.
Meet on that day.
Within 24 hours. The lifespan of the human oocyte, that's the egg, is only 24 hours. But the sperm is strong for 72 hours. But it can still be alive for up to 7 days, but it lacks the ability to penetrate the human oocyte after that 72 hours. So that is the lowest rung of the ladder and it's the cheapest. The next layer is intrauterine insemination. What this does is that we do exactly in the same with ovulation induction. We'll give you tablets or injection to make you produce more eggs. But this time, we'll take the copulation from your partner. We'll ask your partner to produce a semen sample, which we will wash, we will remove the debris, and we will do what we call a swim up using various media, and we'll pick the best aliquot and transfer that into your body, in the clinic. The trained nurse can be taught to do it, the gynecologist can do it, and if you teach anybody, you'll be able to do intrauterine insemination. Okay, that is the next level. Then the next level is you can do gamma fallopian tube transfer. This is still a little bit complicated because you will harvest the egg. You harvest the egg from the woman, clean, obtain the semen sample, prepare it. By preparation, that means you clean it, you wash it, you centrifuge it to get the best aliquot and the concentration. Then you bring that female that human oocyte from the woman and the egg. Then you now transfer it, into the woman. Fertilization has not taken place. The hope is that fertilization takes place within where it has been transferred, inside the fallopian tube, where it normally occurs naturally. This is to reduce costs because a lot of labs lack the finances to buy the incubator. The incubator is looking at a few million, about 5-6 million, depending on the type you want to buy. So to be able to incubate the egg from the woman and the spermatozoa from the man, achieve a fertilization, allow the egg to grow outside by feeding the embryo outside until they reach that critical stage where we do embryo transfer. So there are zipped, we no longer do it because the results are not very good. IUI results are not very good. GIFT results are not very good. Then we come to the popular in vitro fertilization and embryo transfer. The process is still the same, but this time you take the control from the mother or from the woman. All right, you control. You tell her when she's going to. You stop her menses. You give her. You stop her menses completely. Then you give her drugs.
Okay, the doctor stops.
To make her produce eggs. You monitor it. You don't give another drug to enable her to have what we call a surge. And during that surge, you are watching carefully by doing regular ultrasound scan every 24 to 48 hours to monitor the embryo. You see, you know the number of embryos that are growing. Then on the critical day, you bring her in. Then you harvest all the embryos. Then the embryology looks down, or you, if you have been trained, you look down the microscope and pick all the eggs and put them in the incubator where they can survive This time, the man's semen has been prepared, either with a swim up or ordinary by centrifuging. You remove the dead part, the non-motile part, those with abnormal morphology. Then you use a swim up with a special medium. The viable and strong and reliable spermatozoa, they swim up. Then you pick from that top aliquot. That is the aliquot you use to fertilize those eggs. Once those eggs have been fertilized based on color coding, you're able to tell the best embryo from the worst embryo. The best embryo are recruited, and those embryos are the ones that you transfer. But if you don't have computerized incubators that can tell you about color coding of good and viable embryos, then you have to be trained to organize and look at this embryo under the microscope, telescopic microscopy, to be able to tell the best, and you pick them and transfer such embryo to the woman.
Doctor, I need to pause you now. Let's take this call. Hello, caller. Good afternoon.
Hello.
Hello, good afternoon. What's your name?
Afternoon.
Yes, where are you calling from and what's your name?
Yeah, my name is Tony. I'm calling from Cameroon.
Okay.
Yes, I suffered from a herniated disc last year, and I recovered, even though I was paralyzed.
You suffered from what?
I recovered, I have not been able to produce.
Okay, please, can you... Wait, hold on. Can you take it one after the other? Please ask the question again so that we can hear you properly.
Hello? Okay.
Okay, ask the question again.
Okay, I said I suffered from herniated disc last year, but I recovered, thank God. Can you hear me?
Yes.
Okay, now, ever since then, when I make love to my wife, the sperm is very scanty. It's very, very scanty. It's not as, the quantity has been reduced. It's not as many as it used to be before I suffered that problem. I don't know
what's the name of the problem you suffered from?
Hello?
Hello, what's the name of the issue you suffered from?
I had little disc, slip disc. I suffered
okay, sling disc. Okay.
Back.
Okay.
It caused me paralysis. It made me to be paralyzed.
Okay.
But I recovered after over almost a year in the hospital.
Wow. Okay.
And I'm walking now. I'm walking very well. I'm walking very well. The only problem I have now is that my sperm is not many. So anytime I ejaculate, it's very scanty. So I don't know. And my wife and I want another child because we have just one child for now.
Okay.
I don't know what to do.
All right, Doc.
Okay, well, sorry to hear you had a slip disc, but I'm pleased to note that you recovered from it. But how will it affect your fertility and your sperm count? Because what I could get from what you have said is that you have a low semen volume. If you have not gone to assess that low semen volume, you will not know if the count is normal. You will not know if the motility is normal. You will not know if the morphology is normal. Because it's not just the quantity. If it's 1 mil or 2 mils or 3 mils, it's not just that volume. What's important is the content. What's the count? Is it moving? Is it normal in size, in shape, in the anatomy? So if all these parameters are normal, you should not have issues. But we know that exercise, if you have a man that gets regular exercises, produces better sperm than a man who is sedentary, who is watching TV from morning till night. So a woman that exercises, a man that exercises, that goes to work, physical work, goes to play golf or walk on the farm or in the garden, will produce better sperm than the man who is just sitting down and tapping on the computer or just watching television. So exercise has a role to play. Vitamin D has a role to play. Zinc has a role to play. But individually, they are of no consequence. But joined together, they become of issue. So look at all this, see your doctor, discuss with him, assess your sperm count, assess the mobility, the morphology, and let them make a diagnosis. Don't just rely on the diagnosis from your wife, who says that the semen volume has reduced. So you yourself, I'm happy that you have recovered. Try and do a little bit of exercising. Strengthen your back muscle, your thigh muscles, and you'll find that it may help with the sperm volume.
Okay, I think we have another caller. Hello, caller. Good afternoon.
Hello.
Good afternoon.
Good afternoon.
What's your name and where are you calling from?
Okay, I'm from Benin.
Okay.
And for the past year, I've not seen my period. I don't know the cause. Even if you time I started my son.
Okay, how old are you?
Hello.
Hello, how old are you?
For a year and now.
How old are you?
My period is not that constant. Monthly period.
Okay.
Because, like last year, I saw it twice.
You saw it twice last year?
And January, that's when I saw it last.
Okay, so how old are you now?
Even the few times I saw it, I did not notice anything like ovulation. That's
okay. All right, how old are you?
I'm 38.
She's 38?
Yeah.
She's not seen her period for like a year?
Yeah.
She saw it twice?
Well, if you're having oligomenorrhea, the periods are not coming as regular as they should be. So, did you achieve a pregnancy anytime? Have you ever been pregnant? She's gone. Okay, what you need to do, my advice is that see a gynecologist who will assess you and support you with better treatment. Okay?
I can't hear you, sir.
The doctor said you should see a gynecologist who will assess you properly. And if you have difficulties finding one, you can always reach me on 052-290-573. And we will be able to direct you to where you can get help. All right, doctor, we're looking at a fertility program, and you have been giving us, some of it. So which is the best of the few ones you've mentioned?
Yeah, the best and the most expensive.
And the cheapest.
No, the best, and the best is the most expensive. That's in assisted reproduction is in vitro fertilization and embryo transfer. The one our people call the test tube baby. That's the best because you actually get the egg, you actually get the sperm, you bring them together, you actually fertilize, you see it, then you actually see the embryo, you transfer the embryo, and then you give the support system to the mother and monitor the mother and hope that she carries the pregnancy to term. But in everything in life, things can go wrong. So sometimes they're pregnant, they get to 3 months, they have a miscarriage. Or in certain situations, they get to 16 weeks, they have a miscarriage. These things happen. But that is in vitro fertilization and embryo transfer. The IVF is the best. But there are other modalities of treatment we have not been able to touch on, like IVF with ICSI. This is special IVF when the woman or when the man produces very low sperm count, or the spermatozoa, they are abnormal in morphology.
Okay,
so,
Doc, let's pause you there. Hello, caller.
Good afternoon.
Good afternoon. What's your name and where are you calling from?
Michael from Benin.
Okay.
I want to ask the doctor how much is the cost for DNA test?
For what test?
DNA test.
DNA. Okay. Okay.
Well, I think there is a lab in Benin that does DNA tests, and I've never asked him, but I know that it will cost you £120. If you convert that times 500, you get an idea.
Okay. All right. I think Doctor have answered that question. Okay, Doctor, we're talking about the most effective and
I said
quite expensive.
Yeah, the most effective, most reliable in all of the assisted reproduction is in vitro fertilization and embryo transfer. And there are other aspects to it, like intracytoplasmic sperm injection. And people have moved on beyond this stage. But what is possible, I'm talking about what is possible in Benin City as we speak.
Okay, we have a caller. Hello, caller.
Hello.
Good afternoon. Please tell us your name and ask your question.
I'm calling from Inya.
Inya, okay.
Yes, sir. And I'm blessed by name.
Okay.
Please, I'm 16 weeks, but I'm urinating much frequent urinating.
You are what?
I'm frequent urinating.
No, please start again.
She's pregnant.
Frequent urinating.
You are pregnant.
Yes, sir. Yes, ma'am.
How many weeks or how many months?
15 weeks.
She's 15 weeks pregnant, and you are urinating frequently.
Yes, frequently.
Okay.
Okay, when you urinate, is it stinging? Is it painful?
Sir?
Is it painful when you urinate?
No, it's not painful.
It's not painful. But pregnancy relaxes, you know, the renal system because of the hormone progesterone. There's a hormone that relaxes everything, that makes you want to go. And secondly, the growing womb, that's the uterus, presses on the bladder, reducing the capacity of the bladder, so you want to go more often. But generally, pregnant women tend to have increased incidence of urinary tract infection. You may have a low-grade infection. It may not be stinging, but there may be infection. So what you need to do is see your doctor. What we do, we just put a urine strip, and we can read out about 15 things that can be in that urine, and be able to tell you if there is infection. For example, if you have nitrate, protein, blood, the number of pus cells, you know, so many things, the sugar, the ketones, all in that urine strip check. So all these things are important. Do they check that where you do your antenatal clinic?
Okay, sir.
Let them check that for you, okay? And they'll be able to tell if there's infection. You may have a low-grade, you know, urinary tract infection, because it's abnormal for you to be passing urine more than 10 times a day. She's gone.
Okay, she's gone. All right, doctor. And why is this fertility program very expensive?
Yeah, it's expensive because right from the onset, you know, it's difficult to achieve. It has to. It's something you cannot see, you cannot hold. You are looking at it under the microscope. So the microscope has to magnify it at least, you know, 10 to 20 times for you to see the human oocyte. So it requires very expensive instruments. And I told you, if you want to buy a good, top-loading incubator, you are looking at 7 million, you know, Nigerian naira. So it's expensive. And what you use, the rocket aspirators, you know, you are looking at 1.2 million. Everything you use, you are talking in terms of millions. The drugs that are not produced in Nigeria, and these drugs have to follow cold chain. The temperature has to be maintained. So if they are freighting it from Sweden, you know, to Benin, the cold chain has to be maintained, carried in a special bucket, in a special packaging with the DHL to
you know, with all of this and the huge money that one has to pay, it is not 100%.
No, not at all.
You know, and that's what breaks a lot of people's heart.
Yeah, but having said that, it is not a lucky game. The outcome of fertility treatment depends on the personnel who are managing. Right from the beginning of counseling the woman, counselor talks to the woman, tells her about the outcome, tells her what to expect. Because she knows what to expect, and her mind is relaxed. She's more receptive. Because she's more receptive, she will perform better than the person who does not understand the process that she's undergoing. And at every stage, you know, she's having a counselor discuss with her what is happening, the changes that can occur to her body, and the side effects, so that she can detect side effects earlier and report it earlier, so that she's treated. Instead of having cancelled cycles, you don't have cancelled cycle. If the patient comes early, you can manage that cycle and still do embryo transfer. And some of the women go on to take a baby home. The desire of every woman is to have a baby, to have a smile on the woman's face. So the doctors are doing their very best. It is not a lucky game, but the woman also may need to have some luck, because you do the same treatment for 5 women, only one of them will take a baby home. Wow. Yeah, that's what it is.
Okay, what's the best fertility boost for the men? Because, you know, most men live in self-denial. They do not want to go to the hospital because it's usually the woman who has infertility problem, not the man. But what is the best fertility boost? We're not talking about drugs here now.
Yeah,
What's your advice?
it's unfortunate that amongst Africans, especially Nigerians, they think the man cannot have a problem, and which is not true. It takes two to tango. It takes a man and a woman to produce a baby. So men can have problems. Men account for 40% of cases of self-fertility, so they need treatment. In terms of fertility boosts, well, I just rattled some of the vitamins they can take on their own. Individually, they are of no consequence. But when you talk about vitamin E, zinc, vitamin D, vitamin B, in the male, using basal shock, exercise, the mode of eating, all these can have avoiding alcohol, avoiding cigarette, avoiding some of these restricted drugs like Indian hemp. That will boost their marijuana. Yeah, that will boost their sperm count, okay, and enable them to achieve a pregnancy quite readily. So the exercise can boost the fertility. Using basal shock, avoiding hot environment, because the last time we discussed the drivers having low sperm count because the heat around that area is higher than normal. God is a wonderful God. He created the scrotal scarf to be outside of the body so that it is cool. So you use butter shot. When you come back from work, there's no need to just wear your trouser, go to sleep. Loosen up. Let air go around your body so that that area is cool. If you check the temperature, it should be at least 2 degrees centigrade lower than the body temperature.
All right.
And that is the best temperature for spermatogenesis.
All right, Dr. Steve Ogbonga is a consultant gynecologist and the medical director of Gable End Hospital here in Benin City. We must thank you very much for being our guest. Our time is up, hopefully.
Thank you
see you
very
again
much.
on the program.
My pleasure.
All right, people, don't stop calling. Just call, send text messages. Do whatever you have to do to make sure that you have your own baby. It's a very sweet thing. So infertility can be treated if only you know where to go to and how early you discover this. Thank you very much for being part of us today. We'll see you again on Monday. Bye.